Thank you for joining us for our examination of the contemporary family therapy article, The Examination of the Relationship Between Conflict Resolution Styles and Marital Satisfaction, the Mediating Role of Emotional Regulation Difficulties.
Hi everyone, my name is Michelle Etienne, and our group will be discussing the article titled Examination of the Relationship Between Conflict Resolution Styles and Marital Satisfaction, the Mediating Role of Emotion Regulations and Difficulties. So I want to touch on the purpose of the article. So the study focuses on understanding how the way couples handle conflict relates to how satisfied they may feel in their marriage. The researchers aim to explore the connection between conflict resolution styles and marital satisfaction. By examining this relationship, the study seeks to provide insight into factors that contribute to relationship qualities. Another key purpose of the study was to examine whether difficulties with managing emotions help explain the connection between conflict resolution and marital satisfaction. The researchers were interested in understanding how emotional responses during disagreements influence relationship outcomes. This focus ultimately highlights the importance of emotional processes within intimate relationships. The study also aims to deepen understanding of the emotion and behavioral dynamic that occurs during marital conflict. So we all know conflict is a normal part of relationships, right? So the researchers, they sought to identify different conflict patterns that contribute to either relationship satisfactions or distress. So this helps clarify how couples' interactions shape overall relationship functioning. By understanding how conflict resolution and emotional regulations are connected to marital satisfaction, the finding can guide therapeutic approaches and social work practices. The study ultimately aims to support strategies that improve communication and emotional functioning amongst couples.
Hi, my name is Jamie, and I'll be presenting the study sample. This study included a large sample of 706 married individuals. Both members of the marital dyad were not required for inclusion, but rather the study required only that the individual be married. The study collected very limited demographic information, focusing only on age and gender. It did not include other important factors like cultural background, sexual orientation, socioeconomic status, education level, length of marriage, marital history, or other important demographic points. This raises questions about the generalizability of the results. Also, since all participants were married, the results may not extend to individuals in other types of relationships. Looking at gender, the sample was uneven, with about twice as many women as men. There were 472 women and 234 men, which could mean the results reflect women's perspectives more strongly and may influence the overall findings. Participants ranged in age from 21 to 60 years old, covering a 39-year span. The average age was 38.45 and the median age was 40.5, with a standard deviation of 9.03. Most participants fell roughly between 29 and 47 years old. The study did not indicate whether participants were in their first marriage or even how long they had been married. Even with the uneven gender distribution and limited demographic data, the large sample size does help strengthen the study and offers some support for generalizing the findings. Thank you for your time. Maya will be presenting the procedures and process next.
Hi everyone, my name is Maya Aikens and I'll be presenting the procedure/process portion of our presentation. And in this article, they said that the participants voluntarily completed each scale, and those are the scales that I have listed to the right: the conflict resolution style scale, the difficulties in emotional regulation scale, and the married life scale. They completed those scales, the married couples, after providing written consent. And that data was collected in 2021. And they utilized the Preacher and Hayes process macro, which basically it interprets how the variables connect. It takes like a large amount of data collected and it simplifies it. So it also tests how they're connected, why they're connected, and when those connections change. And the results from that was also resampled to expand from 706 people to 10,000 people using the bootstrap method. And this method, it uses repeated sampling from the same data to estimate how accurate or stable a statistical result is. And this just makes the results more reliable because now you're utilizing a larger amount of of a sample. So you have a bigger sample to work with now. And so that was the process and procedures portion. Thank you.
This study looked at the way couples handle conflict affects how satisfied they are in their marriages. The researchers found that couples who use more positive ways of handling conflict, like communicating openly, trying to solve problems together, or actually listening to each other, tend to be more satisfied in their marriages, and that was linked to having fewer difficulties in regulating their emotions. On the other hand, couples who deal with conflict in a more negative way, like criticizing each other, being hostile, or trying to force their partner to agree with them, tend to have lower marital satisfaction. Another big part of the study looked at how emotion regulation, which is pretty much how people manage their emotions during disagreements. The researchers found that people who have a hard time controlling their emotions during conflict also tend to be less satisfied in their marriages. The study did not provide any specific numerical data, like, for example, how many people who used positive conflict styles had marital satisfaction, but instead they used statistics. Um, they found that conflict resolution and emotion regulation explain about 32 to 40% of marital satisfaction. Also, another part of the study showed that avoiding conflict or just giving in to your partner was also linked to higher satisfaction in marriages. The main point of the study was not to show that conflict was a problem in relationships, but it was to show that the way couples handle conflict matters. So, because of that, couple and family therapy should focus on helping the partners learn healthier ways to handle conflict, like communicating more effectively, working together to solve problems, not being aggressive or hostile, validating the partner's emotion, and not disregarding each other's feelings. Therapy should also focus on the conflict resolution styles of the couple, as well as how well they regulate their emotions. Because after all, the study did show us that couples who are better at managing their emotions are more satisfied in their marriages. Overall, we saw that couples who use more positive conflict resolution styles are more satisfied in their marriages. So, therapy should focus on better communication, emotional awareness, and empathy between partners, so that the relationship can be stronger, and that couples can be more satisfied in their marriages.
Hi everyone, my name is Kyle, and I will be talking about how this article is relevant when dealing within our field. When working with families and couples, it is important to help couples find the root of their problems. As social workers, this is important when we're working to help with clients, couples, and families so that way we can help them find different communication styles and how to resolve their interpersonal conflicts. After the experiment, we were able to see how these results showed that the couples were able to find positive conflict resolution styles such as open communication and problem solving, which is one of the goals that we would try as social workers would try to have our clients or couples implement within their sessions. The research in the article demonstrates how effective emotional regulation is when in treatment. Many clients we will encounter and help won't know how to manage their emotions, especially when their emotions can be intense. As social workers, we have to help clients find different effective strategies and skills that will help them navigate their emotions, especially when dealing with a couple with this concern. The research also shows us that it is important for social workers to address behavioral communication patterns and emotional proc- processes when in therapy. Emotional focused therapy, EFT, and cognitive behavioral therapy CBT are some approaches that can be used to help couples develop healthier ways to deal with conflicts and regulate their emotional response to one another. So, as social workers, we help clients try to implement cognitive behavioral techniques as well as emotional awareness exercises and possibly mindful strategies to help these individuals better regulate their emotions during conflict. The study also shows us how, when clients had a negative conflict resolution strategies, how it wasn't as effective. So, us as social workers, we try to help clients find positive emotional styles that will help them effectively communicate their emotions better. The research also supports the need of prevention, education, and psychoeducation. What we found within the articles was how suggesting conflict resolution and emotional regulation skills can improve relationship outcomes. And we also, as social workers, we would provide resources that could help clients and couples um, in this predicament to be able to have a better relationship and when dealing with their emotions. So we would could refer them to partaking in relationship education programs, workshops, or having support groups that may have different couples who are experiencing the same things they are experiencing and who will probably what and they will can probably benefit from them by gaining different knowledges and different resources from others within the community.